Hello and welcome to GBMC's Greater Living Live. I'm Mary Beth Marsden. I think we're all pretty familiar with what primary care is and our primary care doctors, but today we're going to be talking about advanced primary care at GBMC.
At GBMC Health Partners, advanced primary care is not about the number of visits. It's about relationships. As a patient, you can communicate with your care team 24/7, 365 days a year through our easy-to-use patient portal. With weekend, holiday, and extended hours, we're here to meet your needs. See our care model in action with GBMC Primary Care Patient, Arve.
The first thing I always tell people when they're looking for a primary is to find one that's actually going to listen. And when I met her, she did just that. She sat, she listened, she heard what I had to say before she proceeded on with the exam. It's like a domino effect. And it starts at the front desk and then it goes on back. I have a tag team. I call them my tag team. Around 2019, I was diagnosed as diabetic. That stent had put me in the hospital. When I left to go home, my A1C was really high. By the time I left the hospital, they had me so scared to eat. I was like, okay, what can I eat? What do I eat? What do I drink? Then when I came in, they would say, you can eat what you've been eating, just eat it in moderation. Nurse Ann was there and she was excellent. She called me every day to make sure I was eating properly, checking on my numbers. We worked on it and whatnot, and by the time I came in for my follow-up visit, my A1C had came down from 11.7 to 6.9. We were like, yes, this is our goal, to get it down. Even afterwards, she would call me off and on and whatnot to check on me and stuff. And that makes a difference because you don't get that from a lot of places that you go to. I just take it one day at a time because now my family is aware of what's going on with me. I have the support of my family as well as my tag team. I love GBMC. I've had all three of my kids here, and now my primary care is here. They're not just here for a paycheck. You are actually involved now with a team of people, whether it's Dr. Mathy, Nurse Ann, Dr. Wills, Caitlin, the receptionist. It doesn't matter. These are people who are working together as a team for the common goal of seeing to it that your health becomes better.
With 14 convenient locations throughout the Baltimore area, GBMC Health Partners coordinates it all for you. To get started, visit gbmc.org/mydoctor.
That was a very personal story, of course, and now we're going to talk about the bigger picture with the Medical Director of Primary Care at GBMC, Dr. Gregory Small. Thank you so much for being with us, Dr. Small.
Oh, thank you for having me today. I'm happy to be here.
So let's talk about really broadly what I think people are very familiar with the term primary care, and hopefully everyone has a primary care physician. But advanced primary care, I don't know what that means. What does it mean?
Sure. So advanced primary care really speaks to a system of delivery that is a team-based approach to delivering primary care. Traditional primary care was more focused on simply the clinician and their patient. And now what we're doing at GBMC is we're bringing a team-based approach, and some of that's what you saw in the video, where care coordinators and care managers partner with a physician-led team to deliver the highest level of care possible. Our goal for this system is to give the best health outcomes with the best care experience with the least amount of waste for the patient possible. And I can explain more about what that means as we kind of go through here. And I think one of the key features of advanced primary care is that we're shifting a lot of accountability to us, off the patient, and we're putting a lot of emphasis on the care coordination and accountability on the shoulders of the team delivering care.
In the sense that the team at GBMC found that there could have been another another program in between primary care and specialist. I feel like we're used to going to the primary care, and then if we need to be referred to someone else, we would. But this sort of is in the middle of that, where you kind of bring in all the people and you have a team, and somewhere along the line, your folks must have thought there's a need.
Sure. So, the role of primary care is really twofold. One is preventative health, and the second is chronic disease management. And so if we looked at what does care coordination for preventative health look like? One, folks come in and establish with a provider and have their wellness visit, and they get advice on what do they need for cancer screenings, for vaccinations. And so we need to be equipped to provide these, but do it in the easiest way possible for the patient to break down barriers. So when patients come for the wellness visit, they could leave with a colonoscopy scheduled, not just a suggestion to go get one. They could leave certainly well vaccinated with whatever they need, and we have labs on site to provide whatever services are needed to complete their wellness visit at that given time. For care management, this is certainly much more involved. There's a lot of chronic disease managed by a primary care specialist. Hypertension and diabetes and obesity are some of the most prevalent throughout our society. And to manage these conditions and to manage these effectively, it's really best done through the delivery of a team-based approach.
I'm listening to you, it strikes me that almost everyone could use advanced primary care. At first I thought maybe it was just for someone who has a chronic issue or needs a lot of extra specialists involved or pulled into their whatever's happening with them, but it seems like it really would work for almost anyone.
No, our goal is to meet the needs of our community, and that's for all community members, no matter how young, no matter how old, no matter how healthy or how ill. We're here for all members of the community, and I agree with you. I think we provide a beneficial service for all members of the GBMC community.
For people who might be watching right now or watching later, and they have a primary care physician, no matter where that is, and they're pretty happy with that individual, let's say, but they look at what you're offering and they say to themselves, wow, I could get so much more, and also it would be made easier for me to do so. Is that what you're finding people are thinking now?
There are definitely patients that, as they shift into our system from traditional offices, they will often come in and say very good things about their clinicians, but there's reasons that I think they find benefit in making that adjustment to our program. One is access. So maybe sometimes in traditional offices, there's more traditional hours where our offices have providers starting as early as 7 a.m. and staying into the evening, 7 p.m. for appointments for convenience. Each of our offices have weekend hours where we don't want patients to have to turn to urgent cares and ERs if they don't need to, if that's not the right place for them. We want to have access and availability for them. And really, we create a mechanism where patients in our system can have access to a primary care office and provider every day of the year, holidays, weekends, et cetera.
I was wondering if you have the sense that this is the future of primary care.
I do. I think that, even where we're working every single day to do this better and to continue to expand services to patients and increase access and increase ease and the degree of coordination we can provide for patients. We're seeing very clearly, we will hold ourselves accountable to metrics, statewide and national metrics, to assess and hold ourselves accountable to the quality of care we're delivering. And what we're finding is that the more that we proactively work to provide services, to engage our patients in higher degrees of care coordination, the better their outcomes are.
At some information on the screen right now, and I know neither of us want to get bogged down in numbers, but it's really interesting to see what you found so far. And you actually have found that your patients who are getting advanced primary care have fewer hospitalizations.
Patients in the GBMC Health Partners system have actually some of the lowest ER utilization rates across the state. That's one of the awards I'm most proud of our program for achieving. And a lot of that really, I think, speaks to our access, not just to providers when patients need them, but to the support they're getting outside of traditional visits through this team-based approach.
Is this why you have locations now? I feel like you're growing. This idea is growing rapidly.
Right. So, our locations, we have, a very large and growing office in Owings Mills. We have offices further north, Jarrettsville and Phoenix, which is our Hunt Manor office, Hunt Valley. I'm at Texas Station, which is in Timonium. And we have a brand new office there, Padonia, that's been rapidly growing and expanding. We have offices right on GBMC's campus, 3 offices. We have offices at Perry Hall and Joppa Road. And our newest office is at Jonestown in Baltimore City.
Are there different locations that provide access or immediate access to different specialties?
Some locations do have some specialists that come to those patient communities. So there is that. The Padonia office, for example, has orthopedics on site and gynecology, urogynecology support on site as well. But each office may have some different partnerships where specialists can work with their patients at those sites.
Is it easy once you register as a patient to go to different offices depending on what's convenient for you or what may be available to you there?
Sure. So, for any of our offices, patients can directly call offices to, become members. They can use the website, gbmc.org, to identify a doctor geographically near them to connect with them. But health partner patients have certain benefits within the system. Yes, if one office needs to be supported or patient needs to be supported by an additional office, there are times the patients, from a Texas Station office may, go to a family care associate office. Particularly on the weekends, we may have, certain offices that support the needs of all of our patients. But at our new office in Padonia, we created essentially an acute care space for the GBMC Health Partner patients. And so this is for patients who have very immediate needs as an alternate to the ER to be seen in our system by our providers with their records for the best care possible with an urgent care level of service, but within our system. And so patients from all offices, have the ability to come to that Padonia office to be treated.
You brought up the urgent care because I think that's the model that we think about when we think about some of what you're talking about, but yours seems more comprehensive than that. Can I still just walk in?
Right. So we do schedule most office visits. That being said, you have access to communicate to your provider 24/7. This can be through an online patient portal, calling the office. Providers are on call for patients 24/7. The individual offices are. So we always have the right guidance to get patients where they need to be when they need to be there. We have increased hours and increased access through all these means. And oftentimes, patients also find a lot of benefit of even connecting to their care teams in addition to just their providers, because there's a lot of needs that they can meet with care coordination and getting patients where they need to go. You mentioned urgent care. So we're using this in the sense of using an urgent care for urgent needs of our patients that may not need to go to an ER. For example, someone who needs x-rays or suturing or things like that, they could get this met through our Padonia office, rather than our individual primary care offices may not have x-ray. But this was our answer to not have patients use the ER, to keep them in our system to get the best care with the least amount of waste.
Because I think, if you fall down, you think you've broken something, the first sense is to go to the ER. And what you're saying is we don't necessarily have to do that. And it may be better for everyone altogether. But I'm also wondering, too, how technology is helping you reach the community and your patients.
Absolutely. So Epic is our computer system, and there is a patient MyChart feature that is part of Epic. MyChart gives patients real-time access to all of their information. When patients have labs that return, patients immediately see their results. When they have imaging results that return, patients have immediate access to these results. Patients have the ability to send messages to their care team to get responses rather than, put in phone calls and that sort of thing. It can be much more efficient to have a lot of questions answered through the MyChart patient portal. And so technology creates a lot of opportunity for engagement outside of traditional office visits. It's even playing more and more of a role in chronic disease management. We put a lot of work into providing the best care we can provide for patients with diabetes. A patient with diabetes who sees their physician in a traditional model maybe sees their physician every few months and gets some adjustments made, and after 3 months, they may be reevaluated to see how those adjustments worked. By using technology in our care teams, they could be having regular engagements with nutritionists or a nurse to support the education of their illness, as well as sending their care provider glucose logs for feedback during weeks in between office visits so that the care of the patient continues to move forward outside of the traditional visit.
Is this a result of how the healthcare system and the medical profession had to react after COVID?
So advanced primary care, GBMC has been developing this system really since 2010. Advanced primary care is not a reaction to COVID, but it's a great example of how we were ready to react to COVID-19. So to give some examples about that, when COVID-19 struck, we had the infrastructure in place to adapt very quickly for telemedicine needs to continue to meet the needs of patients. And that worked very smoothly, very effectively in many, many circumstances. It was a great benefit to patients who weren't able to come immediately to their office or to maintain their traditional appointments. The approach to managing COVID-19 in the community started with testing, and we were able to open up testing sites for our patients on campus and even off campus at Padonia. And when a lot of community members had difficulty obtaining access to testing, Health Partner patients did have access through their primary care offices to be tested. When vaccinations became available, Health Partners created opportunities for vaccinations for patients right from the start, as soon as we were able to. And we also then spread vaccinations to all of our individual offices, where patients to this day still can be boosted and vaccinated through their primary care providers. And really then the next phase in COVID-19 treatment or COVID-19 reaction was treatment, and having certain medications, antivirals like Paxlovid. This is something that we've brought into our system for patients at our acute site at Padonia to be able to receive when they test positive, and we're spreading that out to more offices so that patients have quicker access to the right therapeutic when they need it.
And what other kinds of therapeutics do you offer? And also, do you offer behavioral health, mental health help?
So I think one of the things I'm most proud of is our incorporation of behavioral health into each of our primary care offices. Through a partnership with Shepherd Pratt, we have behavioral health counselors in every single primary care office for Health Partners. These are folks that a primary care physician is able to refer their patient to help manage depression, to help manage anxiety, or other psychiatric conditions. These behavioral health counselors now partner with the patient in a counseling manner and a regular routine, but they also consult with a psychiatrist who gives the primary care provider advice on if there's a role for medication to support in managing this. Sometimes the answer is there's an opportunity, and sometimes there may not be, but it keeps the primary care physician and the patient at the heart of the relationship, but yet meets the needs of the community, because psychiatric support can often be so difficult for patients to access. It's really been wonderful, especially during COVID-19. So many patients have struggled with anxiety, they've struggled with depression. And what we often find is that if we're not meeting the mental health needs of patients, it makes it very difficult for them to engage with their teams to meet their physical needs as well in managing chronic illness.
And at the same time, they can stay in their own homes while doing so, because oftentimes it's so difficult to find a bed for someone who really needs help in that arena. So it sounds like you're filling a need there too.
Absolutely. It's, with having the opportunity to provide primary care through telemedicine when patients can't come to the office has been a great benefit, and their behavioral health needs can be met in just that same way.
You mentioned a couple of times that various offices that you have right now are expanding, they're growing, they're adding services. I think I remember when the Padonia office opened, so it's telling me that if you're already growing and expanding, you're seeing a great need and people are really responding to these services.
Absolutely. We have patients regularly, calling to enter the program because, and really it's been, I think, through word of mouth, where patients have learn from their loved ones, their family, their neighbors, that they're getting good quality care, and that providers and care teams at GBMC do care, and we're delivering on the message that we're providing today, that we're here to provide the best health outcome with the best care experience.
It may seem inconsequential when you think about it for someone who's got a health need, because they'll go wherever they have to go to get that need met. But really, are you hearing from patients how convenient it is? I mean, just the thought of going to a hospital and finding the parking and getting the parking ticket and figuring out how to get through the building. But when you can pull into a care center such as yours, or advanced primary care at GBMC at Padonia, let's say, or Owings Mills, and you can park easily and you can walk right through the front door and it's all right there. I'm just wondering if they're telling you how reassuring that convenience is for them.
The satellite offices absolutely provide a lot of convenience for patients, and they do enjoy it. They certainly will prefer to get their labs drawn on our site, to have their vaccinations, performed at our site. But I think what patients really learn through this is the importance of having a relationship with a provider who sort of quarterbacks their care. And one of the things that there are times that we certainly still have to refer to specialists, but when we refer to specialists, we're able to do it within our network, and we're able to do it through a common electronic record and keep care coordinated. And a lot of times when patients have trouble, if they do need to go to the main hospital to see a specialist, if they were having difficulty gaining access to the specialty care they need, we're here to get them to the right place a little more efficiently. And I think that's a major benefit for them as well.
Where do you see the future of advanced primary care?
I see it continuing to grow. I think we're going to continue to become even better than we are delivering high quality healthcare. I think we're going to continue to deliver a better patient care experience. And I think we're going to continue to get better and better at care coordination. Technology is not the means by which we're going to deliver care, but it is a tool, and it's a tool that can really help us with increasing ease of access and communication. And I think we're going to see more opportunities where patients are going to be able to expand upon the technology access they have to stay engaged with their care team with more ease at home.
And if someone wants to find out more, they could just go to the website and find out more about the listings and what's available and where they're located?
Absolutely. So through gbmc.org, they have the opportunity to seek, who the primary care providers are in the system, to access the information regarding the offices geographically closest to them, and to certainly to reach out to engage with a provider.
Small, thank you so much for joining us, the Director of Primary Care at GBMC Health Partners. We really appreciate it.
No, thank you very much. It was my pleasure.
And thank